For emergency use in the UK. The British Health Secretary says the first 800,000 doses will be ready to roll out to the public starting early next week.
This is a monumental step forward. It's no longer if there's going to be a vaccine, it's when. This is a day to remember, frankly, in a year to forget.
Millions of doses are already in ultra-cold storage in Belgium and will be shipped to the UK in thermal boxes as early as tomorrow. There are huge logistical challenges, though. This vaccine is the one that must be stored at minus 70 degrees Celsius. Because of that, the UK says the first vaccinations will take place in hospitals that have the facilities to store those vaccines, and that means the most vulnerable residents in nursing homes will have to wait. Tweet today, the federal health minister called the UK approval encouraging. Patty Hajdu says Health Canada's review is ongoing and is expected to be completed. The Prime Minister, who himself almost died of COVID-19, is now leading the world down the path of a mass vaccination program.
It is the protection of vaccines that will ultimately allow us to reclaim our lives and get our economy moving again.
Britain granted the Pfizer BioNTech vaccine emergency use approval. The move follows months of unimaginable grief. The UK has the highest official death toll in Europe.
The safety of the vaccine has been scrutinised independently by our Commission on Human Medicines, and no stone has been left unturned. So absolute confidence in the safety, effectiveness and quality of the Pfizer BioNTech vaccine.
Next week, around 50 hospital hubs across England will start offering the vaccine to the over 80s and to care home staff and others identified.
Vulnerable care home residents and staff are a priority, but officials haven't figured out how to widely distribute the vaccine, which must be stored at an extreme minus 70 degrees Celsius. England's Deputy Chief Medical Officer explained the problem like this.
This is a complex product with a very fragile cold chain. It's not a yogurt that can be taken out of the fridge and put back in multiple times. It's really tricky to handle.
Officials say if enough people take the vaccine, deaths can be prevented, and so can long-term health issues related to the virus.
I have high hopes that eventually the vaccine will make a very, very significant difference to the way we live our lives.
Vaccinations will start early next week and continue for months. It's hoped that in time, other vaccines will be approved, including some that don't require ultra-cold storage, making it easier for people to get the shots.
And in the meantime, Jagmeet Singh wants more details about the plans for vaccines we'll get that aren't made here.
There is no clear plan. Who is going to receive the vaccine? What choices is this government going to make? What is the rollout going to look like? All these questions are still unanswered.
Health Canada is looking at 4 different vaccine candidates. Canadians will be covered on vaccine.